policy?
Doctors for Safer Drug Policy, at its core, we're a group of Vancouver Island addiction medicine doctors, and we work in all sorts of different venues. We do inpatient medicine in hospitals, outpatient medicine in family medicine clinics, in addiction medicine clinics. We provide addiction medicine care in shelters, and yesterday I was providing addiction medicine care in someone's tent. So we do work all over the place. And now we are a much larger group, including nurses and social workers and community supporters and volunteers, and we have some support from really heavy hitters in the community like Moms Stop the Harm and the BC Nurses Union and BC Family Doctors, and we're very grateful for that. The co-founders of Doctors for Safer Drug Policy are three doctors. I am not one of them. I joined a couple months later. Dr. Kelsey Roden, Ryan Harriet, and Jessica Wilder. And it was born out of frustration with, I know no one has seen this before, but harmful government decisions. And so that's kind of where Doctors for Safer Drug Policy started. Around that, Canada has several overdose prevention sites in hospitals, in different sites across Canada. There's one in Vancouver, in Edmonton, Toronto, and Vancouver Island had been promised to have several overdose prevention sites in hospitals, so in-hospital OPSs. These had been promised to Vancouver Island, to several different hospitals, and Island Health was doing amazing work getting towards these and making them happen. At least one of them was very close to starting up when David Eby pulled the plug on that in April of 2024. So all that work stopped. Those programs did not move forward. And that was very disappointing to us as addiction medicine doctors, knowing how important overdose prevention sites are for our patients and that inpatient addiction OPSs are missing. So we have overdose prevention sites in the community, as we've heard from Brent, we have them in all sorts of places in the community, and we know that how important they are. But we also need them in our hospitals because people don't just stop using substances when they walk into a hospital, right? So Dr. Heaslip so well explained, addiction, we always have to remember this is a health condition. It is a disease. Drug use, in spite of consequences and harms, is the manifestation of that. And so when people go into hospital with an addiction, they don't magically stop having that, they don't magically stop using drugs. It's like thinking of a diabetic who would go into the hospital doesn't magically stop having high blood sugars, right? So people do use drugs when they're in hospital, and that is probably unlikely to change. One of the reasons behind that is so important to really understand about stigma that people face when they access healthcare in any sort of healthcare setting. And I was going to spend a little bit more time talking about stigma, but I realized the audience I'm speaking to, I think there is a very good understanding. And if you walk into a healthcare setting personally and you feel totally safe from prejudice, from bias, from racism, from stigma, then you are very lucky, and reflect on that privilege. But many people do not feel safe accessing healthcare services, and people who use drugs, people with addictions are often in that category. So when people are in hospital and they're often, my patients have told me many times, I've practiced addiction medicine for close to 15 years, and I have patients telling me regularly that they would rather die than go to the hospital. And I have had patients who have died instead of going to hospital. They just waited too long, and they were so mortified knowing the way they felt that they were going to be treated when they went to hospital. They just decided not to go. And we know this and we see this. And that is one of the reasons when people are in hospital, one of the reasons that they're continuing to use substances is to combat that distress and that they're experiencing. And another reason, of course, is when someone has an opiate use disorder and they're not able to, the pharmaceutical alternatives that they're being given in the hospital are not matching their tolerance, so they're using as well for that reason. But the main reason people use drugs when they go to hospital is because they don't stop having the disease of addiction, and they're continuing to use. So in hospitals, when there is no overdose prevention site in hospitals, people end up using alone. They use in bathrooms. They go outside. I saw someone just the other day outside of the Jubilee, a sheet over his head, using under a sheet because he didn't want to be seen. I have spoken to many people who live in the Jubilee area, and they see frail patients that are sick, walking down, using in bushes, using somewhere away before they go back to hospital. So this happens. And when people are in hospital already because they're sick, and they're in a frail medical state, they have a higher risk of overdose. And when they use in unfamiliar places, they're also at a higher risk of overdose. So hospital-based OPSs, we know would save lives, but not just would they save lives, they'd also, on a larger level, they would help the system. For example, people would be much less likely to leave hospital against medical advice before they're finished treatment, because they would be feeling more that this is a safe place to stay, right? When people are readmitted to hospital, when they leave, they very often get sicker. They're readmitted to hospital. Every time someone even comes to the emergency department, it actually costs the system close to $1,000. And then if they're sicker because they have deteriorated their health, they might need a higher level of care, like ICU care, and that is much more expensive as well. So allowing people to feel less stigma in hospital, have a place to use safely, not leave against medical advice and get the treatment they need while they're in hospital would certainly help healthcare costs. It would also decrease public drug use, less paraphernalia found in the neighborhoods, for sure, and also less unintentional drug exposure to healthcare workers, which we may hear a little bit more about later. And it would certainly lead to more referrals and treatment and social supports, which we know is a huge part of overdose prevention sites. And most importantly, it would help people engage in the healthcare system and maybe regain some trust in the healthcare system that many people have lost. So David Eby pulled that promise, and 6 months later, Doctors for Safer Drug Policy was founded, and my colleagues initially started some unsanctioned pop-up overdose prevention sites outside of various Vancouver Island hospitals. And this was not just to save lives and for all the other positive benefits that we know overdose prevention sites have, but it was also for public education and to counter some of the harmful rhetoric that we are seeing in the media, and ultimately to pressure the government to move forward with this. Addiction medicine is often politicized. That is also something that Dr. Heaslip spoke to. And we see that a lot. Politicians are making the decisions, not the medical experts. And that's exactly what David Eby did when he pulled back on his promise of hospital-based OPSs just prior to the election. So do politicians campaign on new ways of treating heart disease? Does the Parliament debate best practices for gallbladder surgery? We don't see that. But that's what happens in my specialty. That's what happens in addiction medicine. Politicians are deciding which life-saving tools we get to have in our toolboxes. And we're seeing more and more of these tools being taken away. Mm-hmm. So doctors have been given a huge amount of privilege just based on our profession alone, and most of us have many layers of privilege that even getting to being a doctor. And at DSDP, we feel that we need to use that privilege to advocate for the tools that evidence shows will help save our patients' lives, help them access better health care, decrease stigma, and provide the dignity that they deserve. And that's what Doctors for Safer Drug Policy is about. Thank you.